Hey, welcome back to the Ready State. I want to talk to you a second about something that has been around forever, and it's called scraping. Whether it's gua sha or IASTM, instrumented assisted soft tissue mobilization. The key there is soft tissue mobilization and instrument assisted. So for as long as there have been people, we've been pushing and pulling and making sure things slide, but I want to just give you some basics on how we think about this and as a powerful tool and where we put it into the program. So if I'm trying to improve your range of motion, maybe it's not the best tool. There's just so many factors, right? So we're always taking this systems approach. Is this an environmental system? Is this a movement system? Is this predominantly a joint capsule restriction? Is it a muscle dynamic, sort of muscle-brain connection, or is this a sliding surface issue? And sometimes the layers of our bodies just don't slide well over one another, and that language I borrowed from Gil Headley. So this notion of sliding surfaces, I think, is useful because it really does encompass how sometimes tissues bind up or for whatever reason just don't slide. And some kind of scraping tool can be a really, really powerful modality for this. And one of the things that I think is appropriate is to appreciate that, hey, maybe going after my gigantic quads is not the best use of my time. And where we tend to slot this in is if someone is having a sensitized area, this can be one of the ways where we can get some work at a very superficial level, maybe change blood flow dynamics or microcirculation per Nick DeNubili. And what we can say is instead is, hey, can I change the environment? Can I change how the brain is perceiving this sensitized tissue? And maybe restore how the tissue is articulating with the tissues around it, right? So that's what I can say is happening. And where it tends to have good effect is in areas, because remember, I mean, as we pointed out before, if I pull on my shin here, you can see that it pulls all the way through my kneecap. These are systems, these fascial systems. And so improving one aspect of how the tissue slides certainly may unload a mechanic or change my brain, how my brain is perceiving tension or perceiving threat. But where these systems tend to work really well is what I think is in looking at how the tendon or a particular ligament, but specifically tendon, this is a ligament here because it goes from kneecap to bone, so technically it's a ligament for you anatomy nerds out there. But the idea is sometimes, for whatever reason, the connective tissue fascia system between the tendon and the superficial skin, dermis layers, aren't great. And in these relationships between connective tissue and tendon, this can be a really powerful way to come in very lightly and see if I can improve that locally. Just like cross friction has been proven and demonstrated for 1 billion years to work, I can come in and maybe see if I can make myself feel better. So maybe I can get some blood flow going back in here. And the rules are simple. We say kind of 45 degrees if you have a butter knife, if you have a soup spoon, if you have a spatula, 45 degrees, and it should feel comfortable, just a comfortable pressure. And what I'm trying to do is not see if I can disarticulate my knee, but to see if I can restore how some of those tissues are sliding. And you know, sidestepping sort of the notion of trigger points, which are well documented, and we are happy to point you to the Brook Bush Institute for research summaries on these things. But really we're just saying is, hey, do I have some kind of tissue binding in a tissue system that's become irritated, or in an old cold case of tendinitis, which really isn't a tendinitis, it's not an acute inflammatory response, it's a tendinosis, or more appropriately, we see a tendinopathy. So if I'm having some dysfunction in the tendon itself, in the tendon sheath, right, I'm thinking, how can I get the garbage out and bring the groceries in? How can I change how the brain is perceiving this? And a little bit of soft tissue scraping in this area performed by myself as an athlete is really great, because this gives me a chance to maybe use some kind of topical cream or some local topical analgesic and give myself some relief or on-demand pain relief. And if you just scraped up and down for 30 seconds in a couple directions until it stopped feeling good, that's a pretty good indicator that you need to stop. So the goal here is not to overwork the tissues. Respect that you're still a flesh and blood human being. We see oftentimes people go to town and they've got all these black and blues. If you've got the petechiae, which are the small disruptions in the capillary beds that show up as look like zebras or stripes, then the tissue is overworked. And what I'd rather you do is have an appropriate intervention where I could touch this multiple times, day after day after day, then boy, I don't want to touch it the next day. That's an overworked tissue. So come on in, get a little scrape, and you can see that I'm just working superficially on where this quad ligament is coming in, right? I can get off the corners. Greg Johnson was really keen on restoring how some of these tissues articulated with this ligament. And if you want to look at his work, FAOMT, those guys, those physios really pushed how we were thinking about freeing up this quad ligament. There are other areas that tend to work really well. So not only do we have any kind of ligament, tendinous system where I want to make sure that the skin is sliding, but also sometimes it happens to work well in these osteofascial relationships. So the areas where the fascia and connective tissue is sliding over bones can also be an easy place, an easy win to restore how these tissues are sliding. So, you know, if I have a maybe not super hot, or I have pain in this area, making sure that the skin is at least not just adhered to the system like some kind of exoskeleton suit can make a big difference. Maybe if I'm in my hot tub, this feels good, but probably going after the big muscle groups may not be the best. Going after small areas, small muscles, feet, things where I have a hard time working on sort of the articulations through a ball or a roller might be tricky. Hands tend to be great, but what you'll see is that there are a lot of classic problems areas, de Quervain's tenosynovitis, which is a painful condition of this tendon of the thumb, and we ask, you know, hey, what we can do to desensitize it, maybe get some better blood flow, maybe change how the brain is working on this. Dose and response, done by the athlete responsibly, is a powerful tool to shift loci of control back to the person. When someone's in pain, are you standing in the way from them being able to make themselves feel better and improve their tissue health or not? And teaching someone how to manage this in a responsible way, well, I think we've only been doing that for hundreds and hundreds of years. Go back to gua sha and some of the earliest interventions. So that's how we think about scraping and soft tissue mobilization. Give it a try.